In the bustling world of healthcare, where technology and medicine converge, the essence of caregiving remains paramount. Caregiving nurses provide a human touch, offering solace and support. They are the compassionate souls who go beyond medical charts. Their presence can be as potent as any medicine, soothing anxieties and fostering hope. Becoming a caregiving nurse is not merely a career choice. It is a calling. It beckons individuals who possess a deep-seated desire to make a tangible difference in the lives of others. It requires a unique blend of compassion, resilience, and unwavering dedication. These individuals are drawn to the profession by a force greater than themselves. The best caregiving nurses are not driven by accolades or recognition. They find fulfillment in the simple yet profound act of alleviating suffering and bringing comfort to those in need. Their reward is the gratitude in a patient's eyes, the gentle squeeze of a hand, or the whispered thank you that speaks volumes. At the core of exceptional caregiving lies a bedrock of essential qualities. These qualities are not merely skills that can be taught. They are intrinsic traits that form the foundation of a compassionate and effective caregiver. Empathy, patience, and a genuine desire to help others are paramount. These qualities are not optional. They are the very essence of what it means to be a caregiving nurse. Empathy allows a nurse to step into the patient's shoes, understanding and sharing their feelings. It enables them to see the world through the patient's eyes, acknowledging their fears, anxieties, and hopes. Patience is the unwavering ability to remain calm and composed, even in the face of challenging situations. It is the understanding that healing takes time. Compassion and empathy form the heart of caregiving, coupled with essential nursing skills. These skills enable safe, effective, and patient-centered care. Clinical expertise and technical proficiency are crucial. Clinical judgment, honed through experience, allows informed decisions and appropriate interventions, analyzing complex situations and ensuring patient safety. This skill evolves with new challenges and knowledge. Technical proficiency includes administering medications and managing equipment. Mastery of these aspects is essential for effective care. It requires precision and continuous learning. Exceptional caregiving nurses possess a unique ability to cultivate a healing presence. This presence transcends the physical realm and touches the soul of the patient. It's a combination of genuine compassion, attentive listening, and a calming demeanor. A healing presence begins with being fully present with the patient. It means putting aside distractions and focusing intently on the person in front of you. In those moments, the patient feels seen, heard, and valued. This simple act of being present can be profoundly therapeutic. Empathy is the heart of healing, essential for nurses. It connects caregiver and patient, fostering trust and compassion. Empathy means understanding the patient's experience and emotions. It validates their pain and fear, seeing through their eyes. Effective communication is the cornerstone of exceptional nursing care. It is the bridge that connects nurses, patients, and families, fostering trust, understanding, and collaboration. Clear, compassionate, and patient-centered communication is essential for every aspect of caregiving, from assessing needs and developing care plans to providing education and emotional support. For caregiving nurses, communication is much more than simply conveying information. It is about building relationships. It is about creating a safe and supportive environment where patients feel comfortable expressing their needs, concerns, and fears. This requires active listening, empathy, and a willingness to engage in open and honest dialogue. In the realm of caregiving, listening is not a passive act. It is a powerful tool for healing. Active listening, the practice of fully concentrating on what is being said rather than passively hearing words, is an essential skill for nurses. It involves paying attention not only to the spoken word, but also to non-verbal cues such as body language, tone of voice, and facial expressions. For caregiving nurses, active listening is about more than just gathering information. It is about creating a space where patients feel heard, validated, and understood. It is about conveying empathy, respect, and a genuine desire to help. When patients feel truly listened to, they are more likely to open up, share their concerns, and actively participate in their own care. Effective caregiving is an art informed by science and driven by compassion. While every patient interaction is unique, certain practical tips can enhance the caregiving experience for both nurses and those entrusted to their care. These tips, grounded in empathy and a commitment to patient-centered care, can transform routine tasks into meaningful interactions. Firstly, prioritize clear and concise communication. Use simple language, avoiding medical jargon, and ensure patients understand their care plans. Repeat information as needed and encourage questions. Real-life examples illuminate the profound impact of effective caregiving. Consider Sarah, a seasoned oncology nurse. Faced with a young mother anxious about chemotherapy, Sarah went beyond medical protocols. She spent time addressing the mother's fears, providing emotional support, and connecting her with support groups. This compassionate approach eased the patient's anxiety, allowing her to focus on healing. Then there's John, a pediatric nurse known for his playful spirit. When a hospitalized child refused medication, John turned it into a game. He created a reward chart, transforming a stressful situation into a positive experience. This creativity fostered cooperation and ensured the child received necessary treatment. Section 3. Cultivating a culture of compassionate care. Effective caregiving thrives within a culture of compassion. This requires a conscious effort from healthcare institutions and individual nurses to prioritize empathy, respect, and patient-centered care. It's about creating an environment where nurses feel supported in providing compassionate care and where patients feel valued and heard. Hospitals can foster this culture through ongoing training programs that emphasize empathy, communication skills, and self-care strategies for nurses. Regular debriefing sessions can provide nurses a safe space to share experiences, process emotions, and support one another. Section 1. Navigating the labyrinth of challenges. The path of a caregiving nurse is deeply rewarding but filled with challenges. These challenges test the limits of even the most dedicated individuals. From difficult patient interactions to managing emotional tolls, resilience is key. Dealing with difficult patients is a common challenge. Patients may be in pain or frustrated, leading to resistance. Patience, empathy, and open communication are essential. Compassion fatigue. a state of emotional and physical exhaustion that can occur in individuals who help others in distress, is a very real and often overlooked challenge for caregiving nurses. It is characterized by a decline in empathy, feelings of detachment, and a reduced ability to care for others. Recognizing the signs of compassion fatigue in oneself and taking proactive steps to address it is essential for maintaining both personal well-being and the quality of patient care. Symptoms of compassion fatigue can manifest both physically and emotionally. Physical symptoms may include fatigue, insomnia, headaches, and digestive issues. Emotionally, nurses experiencing compassion fatigue may feel emotionally drained, irritable, anxious, or depressed. They may also experience a decline in job satisfaction, a sense of hopelessness, and increased cynicism. Resilience, the ability to bounce back from adversity, is an essential quality for caregiving nurses to cultivate. It is the inner strength that allows them to navigate the challenges of their profession while maintaining their compassion, empathy, and commitment to patient care. Cultivating resilience is an ongoing process that involves self-awareness, self-care, and a willingness to seek support when needed. One of the most effective ways to build resilience is to develop strong coping mechanisms. This may include mindfulness practices such as meditation or deep breathing exercises, engaging in regular physical activity, prioritizing sleep, and maintaining a healthy diet. Nurses can also benefit from journaling, creative expression, or spending time in nature to de-stress and recharge. The impact of a caregiving nurse extends far beyond the hospital walls. It reaches into the homes and hearts of patients and their families, leaving an enduring legacy of compassion, comfort, and hope. The caregiving nurse becomes more than just a healthcare professional. They become a source of strength, a beacon of light during some of life's most challenging moments. Imagine the relief a patient feels when a nurse anticipates their needs, offering a warm blanket or a soothing word before they even have to ask. Picture the gratitude a family experiences when a nurse patiently explains a complex medical procedure, alleviating their fears and empowering them to make informed decisions. These acts of kindness, often small but always significant, create ripples of positivity that extend far beyond the immediate moment. The journey of a caregiving nurse is not for the faint of heart. It is a path that demands unwavering dedication, boundless compassion, and an unyielding spirit. It is a calling to serve others, to be present in times of need, and to make a tangible difference in the lives of those entrusted to their care. To the aspiring caregiving nurse, embrace the challenges that lie ahead. Hone your skills, nurture your empathy, and cultivate your resilience. Remember that every interaction, every task, is an opportunity to make a difference. Your presence, your touch, your words have the power to heal, to comfort, and to inspire.